Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. I brought my own laptop just in case this one doesn't work. So that's the way machines are for you. Now, what I'm being asked to do in about 10 to 12 minutes probably requires multiple webinars, but let's just get into the meat of things. So AI is different things for different people. AI is maybe just excellence in chess, or maybe it is just self-driving cars for some people, and maybe it is just Rufus who assists you in buying things from Amazon. But what is actually AI in scientific terms? So it is the ability of a computer system to perform tasks that typically require human level intelligence. What is actually intelligence? I'm just going to go through this briefly. It's the ability to perform reasoning, problem solving, and learning. And if a machine needs to reach human level intelligence, it will need to develop the faculties of perception, attention, planning, and memory. Now that's what a machine needs to have in order to become as intelligent as humans. So where are we right now? So these are the three kinds of AI that are currently present. So narrow AI is where we are. We haven't gone beyond this. So narrow AI simply means that a machine will perform a task that you ask it to perform, that you teach it to perform, program it to perform. The intelligence is still subnormal compared to humans. General AI would mean that it's equal to humans, and super AI would mean that it is beyond human intelligence. We are still at narrow AI. Now, I just want to go through some of the current stages of AI in healthcare. And when we look at AI, so what we have is AI algorithms in healthcare that help us with patient diagnosis, especially in terms of diagnostics, and then generate treatment plans. We know that the predictive analysis of AI significantly helped during the COVID pandemic, helping us to predict the course of the pandemic itself. And then now we can use virtual reality, augmented reality, and even mixed reality to generate simulations that can help us plan even coronary interventions. And I think these are some of the very common videos that you see online, especially when you're talking about bifurcation PCI. And when we look at cardiac imaging, it helps a lot in cardiac CT by telling us the different data points and quantitative analysis of the cardiac CT and the coronary arteries. We now have virtual health assistants that will talk to you, answer your FAQs, of course, and then generate a plan that is specifically for their particular patient. Now, what are the advantages of AI? The first is AI in image recognition. Now, this is very complex picture. Just forget about the whole thing and focus on the brain. So that's the occipital cortex. We are now creating artificial neural networks and convoluted neural networks based on deep learning algorithms. And they're all designed around the occipital network. So you first see a major picture, converge into a smaller picture, then move into the final details. And that's what these multiple layers actually show you. So this is what happens when you put an image into an AI algorithm. It picks up the cardiac CT, then it says this is the heart, then it says this is the coronary, this is the lumen, and this is the endothelium. So it cones down from the top to bottom, just like our own occipital cortex. And this is where you can see it. There is image acquisition and reconstruction, followed by segmentation and pre-processing, and then all the way to diagnosis and prognosis. The next important area is natural language processing, in which written or spoken word is recognized by AI. Now, where is this important? This is important in the dictaphone that we use to dictate notes. It's also important in the way I would write a cath report while dictating it into Microsoft Word. So that's natural language processing. And then once we scan the electronic health records, it picks up the relevant information and analyzes that information as well. Now, to develop natural language processing, these are just some of the faculties that are required by AI. And of course, human beings are rearing AI as their own child. So this is वो जैसे बच्चे को आप कायदा पढ़ाते हैं, तो अभी हम कायदा ही पढ़ा रहे हैं AI को. We can also create personalized treatment plans based on genetic information analysis and then lifestyle factors consideration, and give them a detailed plan in order to get better patient outcomes. Of course, we all know that the data analysis speed and of course data analysis accuracy is mind-boggling. What are the challenges? We know that there are significant privacy concerns. We know that the AI is moving faster than the legal framework it is supposed to follow. So the legal framework has to catch up with AI so that we can have less ethical issues. Of course, if you are looking at different groups, for example, in terms of gender, in terms of race, underrepresented groups, there may be a bias in teaching the algorithms. In my opinion, it should not be man versus machines. There is a time in the very near future that I see where we would have to combine the human expertise with AI. Of course, there is always the role of health professionals. There is a conception that maybe we will lose our jobs. No, we won't, because if you look at the economic aspect of things in this book, it's quite detailed by Dr. Darren, and it will simply generate a new era of jobs. So the jobs will still be there. We will still be looking at radiology images. We will just be looking at them from a perspective of AI. So the doctor of the future will have to learn to use AI, and they will be the better ones. I hope these are not my famous last words. So this, to me, is the cath lab of the future. So there will be procedure precision. There will be patient and operator safety. And how will the AI do this? There will be real-time image processing, there will be optimization of the procedure workflow, and of course there will be decision support algorithms that put us through this. And if we look at the role of AI in coronary interventions, we will be talking about computational simulations, machine learning and deep learning networks combined with or output into augmented reality or virtual reality, and this will all help in procedural assistance. Combine intravascular imaging with AI. We are already seeing that in our OCT softwares, in our IVUS softwares with automatic border detections, plaque calculation and length calculations, and even suggestion of what stent to put in. So there are opportunities for AI in imaging, and of course in the cath lab as well. In imaging, the deep convoluted networks and artificial neural networks help us to identify images. For example, you can identify the kind of coronary plaque with the different Hounsfield units in a cardiac CT, and you can see very enhanced detail of the late gadolinium enhancement in cardiac MRI. You can see the calculation of strain and strain rate by the use of speckle tracking software. So this is already there. We're using it in our daily life. Right, thank you. And I'd like to acknowledge the help of Microsoft Copilot 360 in assisting me to make this presentation. It wouldn't have been possible without the help of AI. Thank you.